Good morning, Dr. Patel. Thank you for joining us this morning. I have a few questions for you, if you can shed some light and help answer them. One of the first ones is, during the pandemic, what has the impact been regarding mental health? I know I've seen a lot of different articles and starting to hear more that it's affecting people. Can you provide your perspective on that?
Oh, absolutely. Yeah. Mental health is one of the most affected area as long as the COVID-19 concern, not directly affecting by the virus physically, but the emotional turbulence that comes along with all the social distancing and the way we live our life now and what they call it a new normal that has been affecting a lot. And we not just see in the patient population, but also in the healthcare provider and everywhere you see it's a big impact on the mental health for everybody.
I guess all ages too.
All ages, starting from kids to all the way to our elderlies, everywhere.
If I have the symptoms of depression and anxiety and I go to the hospital, will my symptoms be taken seriously? Because I know there's so much more going on.
We are not ignoring health for the mental health either. I mean, all the mental health providers are working, all the services are up to date, and we have the special wing in the emergency room for especially the mental health.
Our units service 55 plus, so our senior community with mental health issues. If a senior 55 plus goes in and exhibits different symptoms, what does that intake process look like for them? At what point do you determine we need to keep this person?
Right away, separate those patients from high acute COVID patients. As I said, there is a different wing for it. And they would get an assessment from a behavioral health assessment team and the emergency physician. And as soon as they determine that patient needs to go inpatient or outpatient, they would line out the workup according to that. If the patient needs to come inpatient, then we'll just prophylactically check them for COVID-19 so that we don't bring a COVID-19 patient to our psych unit to provide the services. And we give utmost respect and priority to the mental health because we have the separate department for it.
What safety protocols are in place at the Baptist Health System?
Every patient comes to the emergency room, their temperature has been taken, they are given masks, and all the social distancing protocol has been followed there. Once we determine that patient doesn't have an acute medical decompensation and they need a psychiatric help, they would be referred to behavioral health assessment team and they'll take over their care from that point onward.
Family brings them in, can that family member stay through the process of the ER, or right now we can't do that and we have to hand that patient over to the emergency department? How does that work?
Yeah, so we follow the hospital guidelines as a mental health provider. We've been part of the hospital. And we like to lower the exposure to the community and to the patient. So the policy right now is no visitor policy. So as soon as the patient comes to yes, you can bring your loved one to the emergency room and hand it over to our capable staff, nursing staff, and the behavioral assessment team staff, and they'll keep you posted. So question to answer is, it would be hard for a personal relative or a friend to be with them while they are being evaluated because we want to prevent exposure to the friend and to our patient.
Are there opportunities for any virtual visits from a family member?
Yes, we do accommodate virtual visits. We can allot the time slots and they can have the virtual visit with the therapist, or doctor can do the phone calls for them. And they are allowed, I mean, we have a structured environment. So as long as the family member gets everything arranged with the nurse, they can definitely see their loved one on the television or on the computer according to the timelines.
And can I ask you, just in general, for mental health, for any of us, any tips or ideas just how to maybe not be so anxious, to relax? I know people are anxious with everything that's going on right now.
So, right, I mean, I would say as a psychiatrist, I don't want everybody to be not anxious at all. I want to have that certain level of healthy anxiety that would keep you on your toes so that you can do all the social distancing, hand washing, keeping your mask on, but not to be scared of this virus. We are all in together, not just the Texas, not just San Antonio, not United States. The whole world is in this together. So we have to face this. But we need to keep a certain level of optimum anxiety to deal with this, but not to be scared.
Thank you so much, Dr. Patel, for your time. For more information, for those of you who are viewing this, please go to baptisthealthsystem.com, check our Facebook page, our social pages, and there will be a longer version of this as well on YouTube. Thank you so much, Dr. Patel.
Thank you, Mary, for your time this morning.